From the beginning, testing for COVID-19 has been a challenge.
And one issue, major shortages in the supply chain, and even now those challenges persist. Dr. Frank George here with some rare insights into how one local health system has adapted just now. Doc?
Yeah, Devin and Kimberly, before COVID-19, when hospitals ran low on supplies, they would just order more from whoever their usual vendor was. But things are different now. In order to ensure enough supplies to provide patient care, lab directors have become supply chain managers. I had the chance to see how Henry Ford Health System is finding a way to make it work.
So this is like the Wild West where you have to broker it on your own, essentially.
Dr. Richard Zarbo is the chair of pathology and laboratory medicine for the Henry Ford Health System.
So the problem has been, number one, gaining access to the platform. These things are controlled by the federal government, and there's a severe worldwide competition.
That means hospitals have been on their own to find and buy as many of the best systems they can get a hold of. But having multiple different test machines can be an advantage.
Leveraging multiple platforms allows us to at least have independence of supply. If we were dedicated to just one vendor, and they either have a shortage or they cut back our supply by 50%, which is not unheard of, then we'd be back on our knees and wouldn't be able to accomplish that testing for the system.
And supply chain problems go well beyond even large equipment.
Everything has been a scarcity, from the instrument, from the test kits for the instruments, to the swabs, and also the transport media.
The swabs used to collect a sample were such a problem, the Henry Ford Health System had these custom swabs 3D printed.
So that was a solution we had to come up with many months ago.
At this point, the hospital system has gone so far, they custom fill their own transport liquid into separately purchased test tubes to eliminate any disruption in the supply chain.
Now, the Henry Ford Health System actually runs over 1,500 COVID-19 tests every day. So just keeping supplies in stock is a real challenge. And incidentally, anytime a change is made to anything from the type of swabs being used to the liquid that the sample goes in, the test process actually has to go through internal testing to ensure that that change does not affect the accuracy.
You know, Doc, we've talked a lot about flu season coming on and the strain that that might put on the whole system, but specifically, what does this mean for labs then who may be now testing for both things?
Well, it's really going to complicate things in a number of ways. First off, any combined flu and COVID test will have to have its own set of supply requirements that is specific to the testing method. So do-it-yourself solutions are going to be very limited. And then there's frankly just the simple issue of numbers. We expect that those tests are going to be used very heavily depending on how things develop in the next couple months.
You got it. All right, Doc.